Again, if I didn't do so, inspection, we can ask you to just put your hands to the side, thank you. Inspection, making sure that the thorax is symmetrical, no problems breathing, no deformities. I'm going to palpate. Again, not wimpy, but palpate. Okay? Any tenderness. Okay? For you guys, because this is going to be an issue tomorrow. You're not palpating over the boobs, okay? Although most of you may like to. But you're going to start at the beginning, start at the top. Why? Okay? You can palpate here, you can palpate down here, no problems. It's this area that we're worried about. Go in between, like this, for now. And make sure you get around the breast. Okay? So, top, down the side, and then in between, around the bottom. Okay? Any tenderness. Also palpating for any crepitus, deformities, or depressions. There's my palpation. Next, my respiratory expansion. Now, here's where the ribs end, right here. Okay, so I'm just moving up just a little bit. Wrapping my fingers around, squeezing in a little. Asking my patient to take a deep breath in and out. Watching to make sure that my hands move symmetrically, out and in. Okay. Tactile fremitus, same thing. When you feel my hand on your chest, I want you to say 99 nice and slow. Okay?
99.
And I start by my finger, I can't really get the apex here, but my finger's at least on the clavicle. So I'm getting as high as I can. 99. Next.
99.
I came a little bit in here because of the bra factor. And then
99.
Okay, and lateral?
99.
Okay. Okay? Good. Good. Now percussion. When you do percussion, go with the clavicle here. So here I'm moving to the side. Can you see that? Moving to the side. Percussion. Apex. Okay. I'm not like this because this is a bit uncomfortable. Your finger doesn't have to be straight, but I moved this way, above the clavicle. Okay. Percussion, comparing again, one side to the other. 2 taps, and you move on. Sorry. 2 taps, and you move on. Lateral, at the anterior axillary line. Making sure that it was resonant throughout and symmetrical on both sides. Percussion's done. Don't have to do diaphragmatic excursion. So now I move to auscultation. Same thing. Every place I percuss, I'm going to auscultate. I'm going to ask you to turn your head to the side over there. Whenever you feel my stethoscope, I want you to take a deep breath in and out through your mouth. Okay? Above the clavicle. Above the clavicle. Below the clavicle. Below the clavicle. In between the breasts. Okay, and here what I'm doing is I'm still medial, but I'm pressing against the breast, so I'm trying to get as much blood tissue as I can. Okay, and then underneath. Lateral at the anterior axillary line. Comparing one side to the other, making sure I'm hearing vesicular breath sounds, no rales, wheezes, or rhonchi. And that's your lung exam.